Hello everyone, myself Dr. Devendra Kalsen. This is our fifth video on our YouTube channel completely dedicated to homeopathy, the voice of homeopathy. Today we will discuss a case of preauricular sinus, a recurrent suppurative preauricular sinus. Now preauricular sinus is a congenital disorder. It is present since birth. A canal type of sinus in forms in the front part of the ear, and it gets recurrently infected. Now, this child came to us on 4th of January 2018, and with this condition you can see in the photograph. Now when I first saw this child, she was so fearful of the doctors because previously two INDs were done to drain out the pus, and child was referred to surgery to extract the sinus. But the parents got somehow our reference and took the chance with the homeopathic treatment. Now, due to her previous experience, painful experiences with the doctor, the child was so fretful, so tearful, so irritable, just like she behaved like chamomile and belladonna, and her inflammation also looked like belladonna. But I overlooked at that time, as mother told that child was very delightful child before this suppurative attack. But it's the art of homeopath to get to know what is in front of him is correct or it's just an act of situation. Now you see here this kind of suppuration. I took some history of the child and the parental history also, and I decided to first to go with the anti-miasmatic treatment, as I didn't have any characteristic keynote to prescribe on this condition. Although you can say that I can prescribe Salicia or Hippocel, but it will act only superficially, as we were targeting only the suppuration. We have to target why this sinus has happened in the child. Now you see, this child was very fond of dancing, a very responsible child. Any duty given to her, any type of work given to her, she do it with precise manner. Ear pain was especially at the night. Sleeplessness in infants, child must be rocked all night. The mother's problem was that she has to rock her all the night to get her sleep. There was tendency to take cold and recurrent cough and colds in this child, recurrent infections, and strong family history of cancer. About 3 or 4 persons in her maternal side was suffering from one or other cancer. Also, I took the history of the mother during the pregnancy. When this child was in womb, she had an attack of typhoid fever, which was treated by allopathy. Now, strong desire for potatoes. This child can eat all the day, 2 times or 3 times a day potatoes, anything made of potatoes. History of recurrent inflammations, frequent inflammations, and history of recurrent sinusitis. Inflammation of sinuses in children and inflammation of sinuses chronic. It was almost 6 months that 2 or 3 times this sinus got suppurated and got incision and drainage. Now when I reportaged these symptoms, we came along the drug carcinosin. Although Silesia was and Madorinum was near, but they were far away from the carcinosin. All the symptoms were hit on the target by the carcinosin. So I gave the carcinosin as the first anti-miasmatic treatment. Although we didn't give it constitutionally for the child, but to eradicate the miasm, to clear the picture, what is by which the core is covered, to clear the miasmatic layer, we gave carcinosin in the first prescription. Now after carcinosin, some improvement came. A lot of pus drained out of the sinus and some suppuration lessened. Now child was a bit calmer than before, but still there was suppuration, and we were very far away from the cure. During this period, some episodes of acute also occurred, like fever and vomiting. As you can see that if you want to cure a chronic case, then you should always manage the acutes by the homeopathic remedies only. So the fever was managed by the belladonna, as there was moaning at every breath during the fever, and it was a very high fever, and it was beautifully managed by the belladonna. And 2 episodes of vomiting. One was managed by the ipecac, and second one after a few weeks again vomiting occurred, recurrent vomitings. and that vomiting smell was so sour. Even child was smelling very sour. So after when she came to our chamber, there was pungent sour smell from the child, and this was indication for the medicine Reumpal. The second vomiting attack was managed by Reumpal. Now, after these acutes, some change occur in the condition of the patient. Some new symptoms came out, and some deteriorating symptoms which were not good for the child at that time, along with the suppuration, came out. There was desire to be carried. Fastidiousness was marked during this period. Intelligent child, if you taught her anything, she will learn it like this in a flick of a second. Irritability when sick. Although child was delightful all the day, but when she gets the attack of that pain, that ear pain, she gets very irritated and striking her mother. Strong desire for traveling. Anybody goes out, the child goes along with it. Weeping in babies. Whimpering. Whimpering means some sort of continuous moaning, like this kind of sounds made all the day. There also been developed cracked eruptions behind there with some sort of discharge in it, behind both ears lobe. The appetite was diminished. Child was losing weight day by day, and appetite wanting on attempting to eat. As soon as she wants something, but when she tries to eat, the appetite goes away. And when her mother tries to feed her, but there was a severe nausea even at looking on the food. Even when she sees that mother is coming with food, she started vomiting. There was pain in children and distension in the abdomen. Another keynote was involuntary urination. Now this child, before as soon as the urging came, before she tells her mother that she wants to urinate, the whole urine escapes in her pants only. Now this was occurring daily 3 or 4 times a day. It was during sleep also, but even when she was awake also, walking, running, playing out, anything doing at the daytime also it was there. Sleeplessness in general and sleeplessness from pain. She became very delicate, puny and sickly type of person, which was not there before. Emaciation of the infant. Family history of asthma. Now during the period, her mother also told us that she is also suffering from asthma, which occurs only in the autumn season. This was not told by the mother before, but as soon as she told her, we took it in the repertorization. There was aversion to milk and aversion to sweets and inflammation of sinus. So these were the new symptoms, and along with some old symptoms, I repertorized them and came to the drug lycopodium. Now, I was not thinking of lycopodium in this type of case, but still there was indications, and in the repertorization it was coming in the front row, and in the Vitholcus expert system it was also coming in the front, and all symptoms were hit by the lycopodium in that time. So I took the chance with lycopodium, and when I gave lycopodium, something changed dramatically in an instant, just in a week. All the suppuration gone, all the irritability was gone, all the appetite symptoms was gone, no nausea, no vomiting. Child was delightful, happy expressions in the child. She was more cheerful than before, and very less amount of some sort of wound type vision we can see like here, but no suppuration we can see here. After lycopodium, every day was a better one, every night was a better one. Child started gaining weight, started gaining height gradually after the lycopodium, but it changed after lycopodium. When we hit the core, when we hit the right remedy, the physician and the patient both came to know, because something changed dramatically and with the positive impact. So after few days of lycopodium, you can see that there is no such suppuration you can see in here, and child looks completely healthy now. And you can see here with homeopathic remedy, a surgical case, it looks like some kind of cosmetic surgery being done. And case we started from this photo, you can see This was the beginning of the case, and this was the end of the treatment. You can see here the difference. No suppuration, nothing here now. Child is now completely healthy. It took us 10 months, about 10 months of treatment to treat this child. Here now I want to tell you some more interesting facts about this case. Now here you can see in the Kent repertory, you see in the ear section, ulceration in front of the ear, fistulous opening, calcarea, single medicine rubric. Now see, this child was fearful of doctors in the first time, fearful of fearful of surgeons in the first time, fearful of the hospitals at the first time. And this fistula also, although I was not aware of this symptom in the beginning of the case, otherwise I would not have leave this symptom. But you can see this fact that calcarea was also in this row, and the medicine I selected, lycopodium, calcarea are complementary to each other. Also, there is an interesting fact that after carcinosis, in the first fever, the belladonna came in the repertorization and of the fever, belladonna is an acute medicine for calcarea also. So this was some interesting fact about this case. I hope you like my clinical lecture, and you can use this calcarea rubric as a clinical indication and clinical rubric for the preauricular sinus also, because it matches the scenario: ulceration in front of the ear, fistulous opening. So all I want to say is please subscribe our channel. I am working for a noble cause, trying to reach the young birds homeopaths, trying to teach them what real homeopathy is. And thank you everyone. Thank you for listening patiently. Thank you. Please subscribe our channel. Please hit the bell icon so that you can get notified every time I upload a video. And please, if you think my lectures are worth sharing, please share them also. Share the YouTube video also, so that other colleague homeopaths can also take the benefit of it. Thank you. Thank you all homeopaths.